Friday, May 8th edition, whether it's the afternoon, the evening, the middle of the night, or good morning down under. We're really glad that you've chosen to join us at the SADS Foundation. I'm Mike Ackerman. As you know, I've had the privilege of serving as the president of the SADS Foundation since 2006 now, and to be with you. And I want to thank Alice Laura, our CEO, for all that she's done for the SADS Foundation, and to welcome her. And it's just great to be with you. Today's a really special day in the history of the SADS Foundation. It's Young Investigator Award celebration. And at 40 minutes after the hour, we'll be breaking into a celebration ceremony for the next generation of channelopathy investigators. And so I'm really excited to invite Dr. Prince Cannon Carroll at that time, and we will announce the winners. And so that's going to be very exciting. But until then, looking forward to your questions to come on in, and we'll enjoy an interactive session. The questions you've asked over the last weeks have been incredible. We are at what is it now, day 50 something of shelter in and lockdown in our various states and communities. We're still in the COVID-19 pandemic, and hopefully you are doing well, staying well, and living and thriving despite your genetic heart condition and despite this COVID-19 pandemic. I have exciting news for me. My granddaughter, who's 3 months old now, I got to see her on Tuesday. We intercepted my son and his wife as they were driving cross country from California, and we got to spend the day with little Jaden. So my heart is full, and I've been enjoying watching her grow up and letting you watch her grow up with me. So thanks for indulging me to share with you Jaden, Ruby, Lorraine. I'm going to take some questions, and the questions are starting to come in. You know the question format. Make your questions short as possible so I can glance over fast on the public chat side and see them and digest them and then respond to them. And so Eve, welcome. You are the fast finger button, so yours is first, and thanks, Eve. And Eve is wondering whether we know about remdesivir and its effect on the QT interval. And so there are many therapies that are being advanced, as we've been talking about over the weeks. Remdesivir is a drug from Gilead Sciences that was used in the setting of Ebola several years ago, and some of the early efficacy signals are quite promising for the sick, hospitalized coronavirus infected patient who is having highly symptomatic COVID-19. The good news about remdesivir for our long QT families is it really doesn't look like there is any QT signal to it. So there's no QT liability, QT danger, QT warning that's being attached to the drug of remdesivir. And so unlike our long QT families who would need to be on caution if they were to get prescribed the Corona cocktail of hydroxychloroquine with or without azithromycin or the Z-Pak, where you do need to be QT careful with those medications if those medications have efficacy. We don't have to express that warning or alert for our long QT families. So thanks, Eve, for that. And Rick is wondering, so thanks, Rick, about going back to work and wearing these masks affect my CPVT for the worse. I'm not willing to put my self-preservation aside for others to feel better. How do we navigate this universal masking recommendation? I think that's a really good question, Rick. And we here at Mayo Clinic, and I know I had Dr. Susan Etheridge, our vice president of SADS Foundation, with us last week, and all of the medical campuses that I'm aware of have embraced a universal masking policy. I mask, you mask, we all mask together. And again, the notion behind that is the whole business of what if I'm an asymptomatic virus shedder and I don't know it? And what if you are and you don't know it? So I mask to protect you, you mask to protect me if we're within 6 feet proximity to each other. So I am a fan of masking. It makes sense to me. There has been very little exposure transmission here on our campus since we've started universal masking over a month ago now. And I think we need to get used to it. We mask when we go to the grocery store. I masked yesterday when I took my son golfing and went into the clubhouse to pay for it. Disappointed that my son and I were the only two people with a mask on. I think there's some slacking off that's going, and maybe we're all getting numb to this coronavirus thing. And I think we are getting to get slack on social distancing, on masking, on hand washing. And we better keep doing some of these things and doing them well, or we're going to see a flare up. So I would say get used to the mask. It's not that difficult. I've had to wear it all day long, as several of our colleagues have, as we see patients. And I think we can all figure that out together. Lisa is asking about Brugada and running with the mask on. No risk. You can still breathe in oxygen. So if you're talking about going out for a jog, you can jog. I'll admit that when I've taken my dog Bella rollerblading, I haven't wore the mask. I did wear it the first time, but then I haven't been wearing it the subsequent times because we're on a trail where there aren't people and I'm not within 6 feet of them. Stephanie's wondering about an ICD protecting children from some of the new concerning issues of Kawasaki and cardiac arrest in COVID patients. That's a good question, Stephanie. Not an easy question to answer. What she's getting at is there's some evidence that in the very young, the coronavirus infection can cause a vascular inflammatory condition in the coronary arteries, kind of mimicking Kawasaki and potentially causing heart rhythm issues and cardiac arrest and sudden death. This is still overall very rare. So we're taking something that's uncommon, a child being infected in the first place, and then getting the coronary vascular complication from it. So we're starting to see these and hear about these reports. Very rare. I would put my concern, worry, anxiety meter at just past 0 overall with this. If a person has an ICD and their heart rhythm goes into a danger rhythm, the ICD would rescue that rhythm if that rhythm is a cardiac arrest VF rhythm. So ultimately, great question. I would not worry. Diana, oh, I love the spelling of your name. Is there any risk for long QT syndrome because of the warm weather? No risk at all. Warm weather, cold weather, any weather, no difference in terms of weather and the effect on temperature or humidity on triggering a long QT event. And hopefully with the hotter weather, this virus, like many viruses, will see a waning phase because of warm weather. So I hope warm weather brings us some good news. Monique is asking about Ivomectrin, and I don't know what that generic drug is. So actually, I'm going to have to pass on that, Monique, and do some homework on that drug. I haven't heard of it. I haven't been reading up on it. So I will have to come back to that one maybe next week after I do a little homework. Janine is a parent in New York City. Hello from New York. We think about you guys a lot and are glad that things are improving. And we are improving. We are flattening the curve. Finally, we're going to be in this long plateau of figuring out how to coexist with SARS-CoV-2 at a steady pace and at various paces in our community. Some it's going to be barely a trickle. Others it's going to be a steady drenching, if you will. But we are approaching 4 million cases worldwide. We're approaching 300,000 deaths, tragically, 272,000. We are approaching 1.3 million cases in the United States, of which there have been 76,000 plus deaths. So it's continues to cause tragedies in all of our communities, but in many, not hardly at all. And I think that not hardly at all is why we're starting to see signs of people slacking off a bit on the simple measures. We have to reopen the world and our country. We have to do it the right way, and keep washing your hands, please, and stay apart at least 6 feet when possible, and do put on those masks, get used to them. Well, Janine is asking from New York City. She's a parent of long QT1 on antibody testing. And I think ultimately the idea of antibody testing, serology testing, to find out whether we have or have not already had SARS-CoV-2 infection, for which our immune system has already mounted the IgG antibody response. We're going to see that test rolled out more and more. We are not doing it at Mayo Clinic yet in terms of all employees get your serology, find out whether you've had it already or not. I don't know if that is coming down the pipeline. It would not surprise me. I haven't seen any official discussions about that. I saw a study out in Stanford where they have tested some of their employees, and I think serology testing is going to make a good sense of reopening the world as we know it. Carrie, you giving me a little bit of a long one, but I'll do my best. Thanks, Carrie. Corona health condition with the rash. Don't worry about that. So the rash and cardiac arrest for children, and this is again related to the vascular abnormality that can mimic so-called Kawasaki. If you're asymptomatic, I don't think we have to be wondering or worrying about this incredibly rare complication overall. I know Dr. Etheridge is going to join us a little bit, and Dr. Prince, Cannon Carroll, and they could comment too potentially of what they're seeing with respect to this coronary artery complication in children infected with the coronavirus, but it's really rare. So maybe I could ask Prince and Susan when they come online if they have any comments specifically on that. Deanna, LQT2 and public hot weather. Don't worry about the hot weather. Go out, enjoy the hot weather. Stay apart, stay distance, but you're not going to overheat as long as you're staying hydrated, just like our athletes with long QT 1, 2, 3 or anything. They need to stay hydrated when they're outdoors and in hot weather so they don't increase their core body temperature, but it's so don't worry. Jess is asking a really good question. Actually, she has an SCN5A variant that's currently graded more ambiguously as a variant of uncertain significance. Her dad has it should her newborn be tested, and she's following Credible Meds. Credible Meds, if you don't know long QT families, is one of the go-to websites that you need. www.crediblemeds.org or qtdrugs.org. That provides a list of potential QT offending medications that become a long QT patient do not take list. Time out. Are these drugs QT safe? And if they're on the list, there better be a good reason to be taking those medications. And there might be good reasons. I have many long QT patients who are taking medications that are on the list. The difference is they know it, I know it, and I'm okay with it. That's different than being blindsided by nobody giving a pause to think about what's the risk benefit of that long QT patient receiving that medication that is known to affect the QT interval. So All long QT families should know that list, have that app downloaded on their smartphone or have access to it on the internet. And in the meantime, the assessment of whether that sodium channel variant is the real deal, is it long QT3 causative or Brugada subtype 1 causative or not, actually just depends on a lot of factors. So I would not be testing your newborn for that variant unless I knew you had disease electrocardiographically, and whether that's tracking with your father who already has been tested. So that needs to be carefully evaluated by your heart rhythm specialist to decide, does that variant stay stuck in a place that I've called genetic purgatory, or would we look at it and have it tilted towards likely pathogenic or demoted towards likely benign? Our 20-minute session is going fast, really fast today. These are great questions, and we have just a couple of minutes before we shift over to celebratory mode. And Crystal, let's try yours next week. Too long. I'm going to have to pass on it. I'm sorry. And Amanda, thanks for the compliment. Great. It's our pleasure. And let's go. Here's a good one. Rachel, and we'll end with Rachel's. Rachel, you get the final one, and the ones that I passed over we'll pick up on next Friday. So be sure to join us back next Friday. Same bat time, same bat channel, and maybe bat. Remember, I like Batman and Robin, and I know bat, Wuhan virus, and everything. So don't worry about that. Give me a little latitude there. But Rachel's asking about CPVT. So for our SADS families who don't know, CPVT is catecholaminergic polymorphic ventricular tachycardia, CPVT. It's due 2/3 of the time to mutations in the RYR2 gene that builds the so-called type 2 ryanodine receptor. Those families with CPVT are at risk of exercise-triggered or emotional-triggered syncope seizures or worse. It kind of mimics type 1 long QT in terms of the triggers, except that the QT at rest is always normal and the abnormality is caught during stress testing. So in the setting of COVID-19, really no concerns. So life as usual. We're not aware of a single CPVT patient out there in the SADS universe that has gotten significantly infected with SARS-CoV-2 where they've contacted us at SADS with telling us that they have COVID-19. But that reminds me, fill out the SADS Foundation survey about your experience. Have you had SARS-CoV-2? What's it been like? Be sure to fill out the survey. I know 50 plus of you have already done so. And so do fill out that survey. So really, I don't think you have to change life at all, whether you have CPVT and you're a CPVT family or you're my family. And you should do with your family what I do with my family. I take my temperature. I wash my hands a lot, soap and water, hot water, 20 seconds. We stay distant. Do keep distance, 6 feet or apart. Gatherings of 9 or less if you're in a state that is granting sort of the R1 phase in the United States of gatherings. Otherwise, stay apart, wash your hands, and put on the mask. And so with that, we are at 1:40 Central Time, and it's really special that we're going to spend the next 15 to 20 minutes celebrating our Young Investigator Awardees. And so I want to just take a moment for those of you who might not be familiar with the SADS Foundation to go down memory lane a little bit. And we'll give honor to Dr. Michael Vincent, the late Dr. Michael Vincent, who passed away at age 79 on February 12 of this year. He is the founder of the Sudden Arrhythmia Death Syndrome Foundation. He started his practice in the 1970s at the LDS Hospital and the University of Utah in Salt Lake City. And there they gathered many families that had this syndrome. Long QT syndrome was first reported in 1959 and the early 1960s. Well, gathering those families as Dr. Vincent and his team did, and then partnering with the great Dr. Mark Keating and his genetic discovery lab, they as a team brought forth the birth of our discipline of the cardiac channelopathies 25 years ago in 1995, when the first long QT disease genes were discovered. And 1995 and 1996 was the birth of LQT 2, 3, and 1 in that order. And as he took care of these families, he also became quickly aware of the lack of recognition of this syndrome, the unawareness, the knowledge gap that existed, and the failure to respect the SADS warning signs that might be being exhibited. And so, as a call to action, he birthed and formed the SADS Foundation in 1992, 28 years ago, with a mission to save the lives and support the families with SADS conditions like long QT syndrome. And over these last 28 years, we have become the world's largest and leading nonprofit organization dedicated, devoted to families with sudden cardiac death predisposing genetic heart rhythm diseases like long QT syndrome, CPVT, Brugada syndrome. I had the privilege of joining Dr. Vincent on his board in 2002. In 2002, 18 years ago, is when Alice Laura became the CEO of the SADS Foundation, and she has led us beautifully for these past 18 years. Dr. Vincent handed the baton to me 14 years ago when I became the second president of the board, and Susan Etheridge joined me as vice president. We have enjoyed serving you since then. And the purpose of the SADS Foundation, we have several pillars. Prevention and awareness. We have to increase awareness of the SADS warning signs, and we do that. Support, really that is who we are. It's who we've been for 28 years, to be there for you, the SADS families. Medical education, to decrease the knowledge gap that exists among the front lines, emergency physicians, nurses, school nurses, and the funnel to the heart rhythm specialists, where many of you families ultimately get care for. Make sure that the heart rhythm specialist is as comfortable and confident with treating these conditions, because these conditions are outside the sweet spot for the vast majority of pediatric and adult heart rhythm specialists. So we've been about medical education, and we have a very distinct scientific advisory board of over 25 leading experts throughout the world that guide us and advise us on how to do a better job with medical education. And we support research and advocacy. We're not large enough or funded well enough to do multi-$100,000 grants and things like that, but we do all we can to connect subjects, patients, to interesting programs and research projects. And the other thing we do with research and advocacy is recognize and encourage the next generation, and the next generation of young investigators to have passion and excitement to get smarter about these genetic arrhythmia syndromes. And really, we've had a SADS Foundation Young Investigator Award since 2008, and we're so grateful to Courts K. Cleveland Jr. and the family for endowing this award so that we could do it every year and recognize mentee and mentors from the best of the best in the basic science category and the best of the best in clinical translational research. And in looking back, it's been kind of neat. Our very first SADS Young Investigator Awardee was Dr. Geoffrey Kim. Dr. Kim and Houston, Texas was going to be the host for this year's SADS Foundation conference, which got COVID. And because it was coronated, it got canceled. And so they will host it in fall 2021 next year. And also Dr. Jeff Kim, our first Young Investigator recipient, was just voted to become the next Vice President of Administration for PACES. PACES is the Pediatric and Adult Congenital EP Society. So Jeff, congratulations. We at the SADS Foundation would like to think we had a little bit to do with launching your career and your leadership role. And since that very first one in 2008, with these next two awardees to join it, we've awarded 26 young individuals with the Investigator Awards. These are individuals who are either early in faculty or even before as trainees, as cardiology trainees, genetic trainees, genetic counselor trainees, or even residents earlier. It's even open to medical students as we encourage the next generation. These two winners today, the check is in the mail for your $500 award, and enjoyed, as is your plaque. And so I'm delighted with that as a backdrop of who we at SADS Foundation are. And if you didn't know us and you want to get to know us better, or in fact, if you want to donate to keep the legacy going, you can go to www.sads.org, and in the top right corner is donate now, and you can give us a financial token of your appreciation and gratitude, and we would just thank you for it and promise you that we will put it to good use. With that, it's really a treat to have Dr. Prince Cannon-Carroll join me on the screen. Prince, besides being a great guy, is a pediatric heart rhythm specialist at Vanderbilt University in Nashville, Tennessee. We've known each other a long time, and he is one of the real men in our field. And so, Prince, welcome. Prince also is the Vice President for Research for PACES, and in that role on the executive committee, he has chaired the PACES Research Committee, which reviewed all of these submissions and then had the tough task of choosing the winners. So, Prince, I leave the screen for now, and I let you introduce all of the nominees, and we want to just thank you and thank them for participating in this year's competition. Thanks, Prince.
Well, thank you, Mike, for the introduction, and I really want to thank the SADS Foundation again for their support of this award, as well as the Cleveland family. As you mentioned, it's very important to recognize the young investigators in our field. And I, as the Vice President for Research for PACES, I get to administer this award, but the nice thing is I don't actually have to judge them. I simply tally the scores from our reviewers. And so I did want to thank the PACES Research Committee, specifically by name, Ann Dubin, Rob Hamilton, Andrew Landstrom, Mark Levin, Raina Tan, and Ron Tennell, who had the difficult task of having to select from among these outstanding candidates this year. And so I'm going to go ahead and go through the nominees in alphabetical order. I think there's a graphic that's going to come on the screen so you can see their faces and follow along with me. I think it's coming on the screen. Maybe I can't see it, but I'll go ahead and start listing the nominees in alphabetical order. So first we have Yukiko Asaki and her mentor Susan Etheridge from the University of Utah. Then there's Dan Clemens and his mentor Mike Ackerman from Mayo Clinic. Taylor Cunningham with her mentor Shu Sanatani from British Columbia Children's Hospital in Vancouver. Aravind Gade and his mentor Geoffrey Pitt. There it is. Now I can see the list of nominees. Yeah, so I'm up on the upper right there. Aravind Gade with his mentor Geoffrey Pitt from Cornell in New York. Then we have Alan Sugru with his mentor Mike Ackerman from the Mayo Clinic. And then last but not least, Carrie Turkowski with her mentor Mike Ackerman from the Mayo Clinic. And so, again, there are two winners. First, I'll announce the winner in the basic science category. And so the winner of the 2020 SADS Young Investigator Award for Basic Science is Aravind Gade. Aravind and his mentor, Jeff, should be joining us on screen.
Hi.
There he is. Hi, Aravind. So if we were in person, we'd invite you up on the stage. I'd give you a handshake. Again, as Mike said, the check and the plaque are in the mail, so congratulations.
Thanks a lot. Thanks to the SADS committee and PACES committee for selecting me for this year. Thanks a lot. And thanks to my mentor, Dr. Geoffrey Pitt, for guidance and his support during this time. Thanks a lot.
Yeah, outstanding work. So the title of Arvind's paper is An Interaction Between the 3,4 Linker and C-Terminal Domain in NAV 1.5 Confers Regulation of Inactivation by CAM and FHF. And so that paper's already been published. Anybody who's interested can go ahead and read that. So thanks again, Aravind and Jeff. Congratulations.
Aravind, Jeff, congrats. Great job.
Thank you very much.
All right, and now the second winner in the clinical and translational category, clinical and translational science category, we have Yukiko Asaki and her mentor, Susan Etheridge. Yuki and there they are. Congratulations.
Yay!
So Yuki's paper is entitled An International Multi-Center Evaluation of Type 5 Long QT Syndrome, a low penetrant primary arrhythmic condition. Congratulations to both of you.
Thank you so much to the SADS Foundation and to PACES Research Committee. Thank you so much.
Congrats, Yuki and Susan.
Congrats. Bye now.
Well, Prince, I'm going to give you a few minutes. Maybe we'll come back to that one question about sort of the pseudo Kawasaki stuff and anything that you guys are seeing that you need to correct me on, because obviously that's not what I've been thinking about lately. But I know that question has come up. Anything that you and your people are observing with this? Yeah,
so we haven't been hit too hard here in Nashville, but one of my colleagues who works more in the MRI inflammatory space has been communicating with some investigators in France, and they're saying this Kawasaki-like syndrome, it's similar in that it's got the rash and it's got the sort of toxic shock appearance, but they are not seeing coronary problems like we do in Kawasaki's disease. So I guess that's the one upside of this sort of newly recognized syndrome. I see Susan's here. She can comment as well.
Yeah, Susan.
I think one of the important things is that we not underestimate that Kawasaki disease is occurring and just blame the illness on COVID, because the manifestations of Kawasaki disease include coronary artery disease, and that is obviously treated differently. So important that people recognize it. It sounds like it's very rare. The KD Foundation in the UK, for instance, there were 20 children out of millions and millions of people. And so if it is a problem, it seems to be quite rare.
Great, thanks, Susan. Susan, before you leave us, anything that you want to say? We have a couple minutes. I'm going to give you the second to last words, and then Prince, last words on behalf of PACES, and maybe say a couple words about PACES for our SADS Facebook Live community who may not be very familiar with what that entity is. And then I'll let you two go goodbye, and then I'll give some final thoughts to our audience today. Susan, yours.
First, I'd like to thank Yuki for her hard work on this paper, and also Jason Roberts and a huge team of people that put this data together that included Dr. Ackerman and Dr. Sylvia Priori, important members of the SADS community. Also, I'd like to just reiterate what Mike said about wear your mask, wash your hands. It's going to help. It's the only way we'll get through this.
Thanks, Susan. Take care. Prince. Again, Prince, thank you for your role as Vice President of Research and the committee's role, the research committee, and all the names you mentioned. Personally, I'm very grateful to them for doing this every year, and it's been a pretty special SADS Foundation PACES relationship.
No, absolutely. And so for those who aren't aware, PACES is, again, the Pediatric and Congenital EP Society. So really, we take care of the entire spectrum of heart rhythm disease in children and in those young adults and older adults who have congenital heart disease who really aren't our adult colleagues aren't quite as used to them. And so obviously part of that includes all the channelopathies and the diseases that the SADS folks are well aware of. And as you said, we've had a really great working relationship between our two organizations. We really feel that that the partnership we have with SADS that involves coming to our annual meeting every year, as well as the number of PACES individuals that are on the SADS Scientific Advisory Board and so on is really mutually beneficial. And so again, I really want to thank the SADS Foundation and you as well as their leadership for the role we've had together. And I hope we continue to synergize our efforts in the future.
Great, thanks. Have a great weekend.
Thank you.
And this brings us almost to the top of the hour. Next week, we're going to have a really special program. I hope all of these have been. Give us some feedback as to what topics you might want covered in the future. Right now, we have shifted. In the past, we were doing every Friday and Monday. Now we've been moving to every Friday, and we'll do every Friday for probably the next few weeks. And then you let us know, do you want every Friday, or do you want us to move to every other Friday or once a month? Or do we change how we do and what we do? I'm just seeing some on the side. Lisa, you are so welcome. Thank you for the kind words. And also, Heather, we have come a long way since you had your cardiac arrest at age 12 in 1978. Wow, we've come a long way. And so, and then I do need to just mention the last one because it's a really special one. The last one to come on in is from Becca, and I'm even going to use Becca's last name. It's Asaki. Does that ring a bell? Yeah, it's Yuki's sister. That's my sister, she says. Go, Yuki. So I love siblings in love. So I would be proud too. So that's a really neat Yuki Becca moment. So I hope you enjoy that. And I'm sorry for our winners that we couldn't recognize you live and in San Diego at the PACES meeting, which would have been last night, I think, or the night before. But let us know what we can do to be meeting your needs. Dr. Vincent, 28 years ago, started the SADS Foundation for you. Since 2002, when Alice, Laura, and Susan Etheridge and I joined, and for the last 14 years as CEO and president, Alice, Susan, and I have stayed committed to the you in this. This program and this foundation is for the families. It's not only, as Dr. Vincent said way back then, to meet a need, but as we added, for you to live and thrive despite your diagnosis. The goal no longer, and has for many years, has been not to prevent sudden death. Overall, that's pretty easy. That's great news. The goal has moved, the goalpost has moved to how do we enable you and your children and your children's children to live and thrive fully despite this. And how do you thrive when we're even in the midst of an anxiety-provoking pandemic like COVID-19? I want you to thrive now. I want your families to get closer now than they've ever been, not just because we're forced by social distancing rules, but by this chance to reconnect in ways. In some ways, this time with my family has been one of the most beautiful seasons in our family's life, except for missing all the granddaughter part. But I've had dinner with my 16-year-old daughter for, I think, almost 60 straight days. I've never been home for 60 straight days since my career started 20 years ago. So make the most of this time, whatever situation you're in. Do not fear. And I love that one of my patients made that little art thing, hashtag do not fear, when she heard me say that. And we're at the top of the hour. So just in case you missed it, I leave you with that. My heart is full. I hope yours is as well. Until we see each other next Friday, stay well, stay safe, wash your hands, stay corona-free for as long as you can, because we're making tremendous advances with each passing day and each passing week. So take care, everyone. Blessings to you and your family. And thanks, Aaron, for hosting this again. Thanks, Aaron. Nice job.